suicidality.
Sorry, I
Thank you
just
for
realized.
recording.
Sorry. Thank you.
Because I was about to send you a request.
I was like, oh
Um,
no.
but I would go, obviously she's got OCD, but I would say complex PTSD
Yeah.
because this began in childhood. And um, I have a lovely book called, now it's not going to show, the Complex PTSD Workbook.
Mm-hmm.
And sorry, my room is a mess. I live with my elderly parents, so it looks like a hoarder's paradise behind me because I've got a house full of stuff in one room. So
Yeah.
that's why I've got the background.
The beautiful
No worries.
background.
I actually have a background I don't know how to get rid of. This blue blob behind me. No, seriously, I have zero. I have tried everything. I go to like blur and it just blurs blue. I go to no background and it's still blue. I don't know what's wrong.
You're just floating.
I'm totally floating.
So I mean, that's my 2 cents on the diagnosis. As
Mhm.
far as the complex PTSD workbook, I mean, it goes over, well, first and foremost, uh, it begins with the back cover. You are not broken in need of fixing, rather you are deeply hurt in need of care. And I think Alex did a wonderful job in pointing out Haley's strengths as far as her resilience. Um, and the book goes through different treatment options, whether it's trauma-based CBT, DBT, different uh, ways to obviously use yoga. So I think that would be attractive to you, Nora. But she's already using a lot of wonderful coping skills regarding exercise.
Mm-hmm.
Um, and it also plans for the barriers, if I can find the right page. Um, Bumps in the road, page 64, no therapeutic processes without its challenges and pitfalls, if you're prepared for them. So for Haley, I can certainly see some overwhelm, maybe a
Mm-hmm.
little resistance, because her cognitions are, I want help, but nothing's worked before.
Mm-hmm.
Um, there's some unhealthy urges, maybe not so much for the addictive piece in the way that we would recognize it.
Mm-hmm.
But I can certainly see that she would isolate a little bit more than she is now, by experiencing some bumps in the road, because there could be a tendency for perfectionism, a
Mm-hmm.
lot of all or nothing thinking, and the intellectualization, especially being hyper aware of treatment modalities, but without following through, I think is something that shines through with Haley as well. So I
Mm-hmm.
will shut up and let the rest of you ladies participate.
I do agree with you on her like defensiveness, especially when it comes to like her anxiety. I think from an outside glance, it would look like selfishness, but when you really listen to what she's saying, you really like look at her words. When you listen to her words, I think that you like okay. I think that she's talking a lot about like how it will impact others, like how her actions will impact others. So
Right.
definitely that anxiety there. Um, the unresolved trauma, like how you talked about like complex PTSD. I think even with that, like EMDR would be something that could be useful if she's
Yep.
open to that.
Yep.
Um,
That's
to
listed in the book as well.
Okay, awesome. Yeah, to like break down those defenses for sure. Especially when it comes to like
Uh-oh.
anxiety.
I think we
If she's
froze.
having, oh, sorry.
No, my computer froze for a second. I'm sorry, Erin.
Oh, no, you're good. You're good. Sorry. I was like, if she's having anxious thoughts about if nothing has worked, and then like you try to jump in, not you, just like general, you try to
Mhm.
jump into a treatment with her. And you're like, okay, like let's try this again. Like immediately, your mind's gonna be, well, it's probably not gonna work. So I think, yeah, to break down a little bit of that defensive mechanism that she has going on with the wall, just do the EMDR, I think could be helpful.
Absolutely.
I love that suggestion too, because I feel like she frequently kind of came back to the idea of like, I just like can't put the pieces together. And like she would frequently say, like, I'm just trying to like process it. Like she definitely lives within that part of her brain. And so I feel like the EMDR and any of like kind of the body work, like you suggested, like could help her kind of like shift from that way of functioning and start to reprocess some of the things that she's experienced so that like her behavior moving forward can feel different and can be different.
I also think another barrier, since she feels like she has to care for her parents, but she also kind of contradicted herself saying that she's distant from them in a way. I can see that being a barrier as well of making that uh, boundary of mom, your suicidal threats are no longer acceptable, and I'm not going to be made to feel guilty about it just because I'm not who and what you want me to be. I think she's got ways to go on that, but I think she could get there with a lot of time. And I mean, I'm not really sure what the regulations are in the UK regarding um, Alex's parameters of how many sessions he can offer, or even what the insurance would look like about that. But I know ongoing treatment with no end in sight, unless you're paying out of pocket, just doesn't happen in a managed care system, unfortunately.
I also said some barriers might include like limited communication between providers, confidentiality concerns for professional like ego conflicts. Like there was described when she said many agencies don't play nice in the sandbox.
Oh, absolutely.
And then I said, you know, her own belief she's unworthy of help, which may cause disengagement. So, you know, as collaborators could help as maintaining like the clear communication and setting boundaries and just practicing transparency about each professional's role so she feels supported rather than overwhelmed.
Right.
And in terms of treatment, I said, you know, I know she didn't feel CBT was necessarily helpful, but I had said like exposure response prevention, ERP,
Okay.
since CBT was like somewhat superficial. So like integrating some sort of trauma-based, trauma-informed or scheme-based CBT model could actually help address like core beliefs of unworthiness, maybe. Psychodynamic or inner child work could like complement that.
Yeah, I think the interpersonal family systems therapy with the inner child work would be really beneficial for her.
Yeah.
Yeah.
Agreed. Yeah. I think it's also like just like a side, like not necessarily like a treatment plan or part of it, but just like a next step. I liked how she talked about like her friend group at this point being different than how she has engaged socially. And I do feel like with her age and the things that she's identifying, it feels like there are these like hormonal shifts that happen in like perimenopause and menopause that like just kind of get women to a place where they like now start to feel worthy or their relationships start to shift because of like that phase of life that they're in. So I do feel like it would be helpful for her to just even have a like engage in a group of perimenopause or menopause women and just like have that be kind of the focal point of that social connection. And also I think that that could encourage that shift to continue in her own mind and the way that she views herself, which I think could eliminate some of the barriers that I identified before too, that you guys have all said too.
Great idea.
And also her health with regarding her heart. I mean, I know with perimenopause and menopause from firsthand experience, there can be issues with tachycardia as well. And she could go from 0 to 100 on this is just a normal symptom of my hormone shifting versus I'm going to have another heart attack or die. With her lack of effective coping skills at this time. So that could be another barrier.
That's a good point.
And then I don't remember. I was actually trying to find it now in the video. I was trying to go back. they were talked about AD or ADG. They talked about OCD in the beginning. Um, did she say in the beginning that she's been assessed for that? Because I'm trying to remember that conversation because a lot of her like thoughts, like they talked about like a while ago, was like she had a lot of repetitive behaviors.
Mhm.
So I didn't know, like, was she diagnosed with that previously?
I think
It
she had
didn't really
mentioned
say.
like she had sort of mentioned that like starting at age 4 or 5, and she kind of like listed off like a whole bunch of, like OCD, depression, health anxiety, but like
Hmm.
I don't know that I didn't hear like how she got to that place or like how she had
Right.
been assessed or diagnosed. It just was like sort of understood at that point for her.
I took some notes, and from what I gathered, I'd have to watch it again, but like what I jotted down,
Yeah.
I said presenting with severe anxiety, obsessive compulsive symptoms, been present since early childhood. I said along with depression and health anxiety, which was recurrent, manifests as repetitive checking behaviors, intrusive thoughts about harming or upsetting others, an overwhelming sense of responsibility for keeping people safe, I think, and
Hmm.
struggled
Mhm.
with feelings of unworthiness and guilt, which seemed rooted in early trauma, her mom's repeated threats of suicide. So
Yeah.
I don't, I think, yeah, when she was young, it sounds like it, I feel like it was diagnosed, right?
Yeah. Like she said it in that way, but yeah, I don't know how it came to be, but yeah.
Yeah.
Okay. Yeah, because I know that like it's been built off of now. Like it's not just OCD right now. It's a lot more,
Right.
there's a lot more going on. But that's why I was like, oh, I just didn't know if she currently had been diagnosed with OCD or if that had been phased out. So yeah, thank you for the clarification.
Mhm.
And I did like what you said about the stage of life that she's in, Nora, because I honestly like I think about the mind body connection. But I was thinking about it in terms of like her knee injury with like her exercise coping
Mhm.
skill. I wasn't honestly even thinking about the stage of life that she's in, so that helped me kind of put this now into a different perspective too.
Mhm.
So I appreciate you bringing that up, and help me to remember stuff like that for the
Mhm.
future as well. But yeah, that's a very important point.
Mhm. Thank you.
I also would probably suggest that she swims
Right?
instead of
Oh
like
my gosh, I
walking or
was thinking
something.
that when she was talking too, and I was like,
Yeah,
no, don't
that's a
get a
great idea.
badminton, go swim. Like,
Go
yes.
swim. Yeah.
It's a great vagal nerve uh, reset.
Yeah.
I
Yep.
really I liked for the provisional diagnosis. I think Erica, you had said, the PTSD features. Somebody mentioned PTSD. That's something that I had thought about, but I was more focused on the when looking at the DSM-5. I was more focused on obsessive compulsive disorder, and then like
Hmm.
major. I looked
Yeah.
into major depressive disorder and generalized anxiety disorder too.
Hmm.
Yep.
So
Yeah, I have those written down as well.
yeah, and so I think that was, I do think it's interesting that we're all discussing, whether her trauma history could really point towards the PTSD features too.
Hmm. Yeah, I had those three too, Carolyn, and like I'm like looking back at the, post-traumatic stress disorder and the DSM-5, and I don't there are some things that feel like it applies, and then there are some things that don't, and
Yeah.
so I'm like I feel not solid on that. Like I'm just
Yeah.
like looking at her as a whole person, like I'm like, oh yes, that definitely feels.
Hmm.
But then when I like go through line by line, I'm like, oh, I don't know.
I know. I know. That's why I
Yeah,
had it like at the bottom, but it was interesting that it was brought up too because it
yeah,
it does strike you with her history and everything.
for
So,
sure, for sure.
Yeah. I mean, I think what struck me the most, it's on page 302 in the TR, persistent exaggerated negative beliefs or expectations about oneself or others, or I'm bad, or no one can be trusted, or the world is completely dangerous, which would lead to the cognition and
Yeah,
the anxiety of not wanting to leave the house for 2 years.
yeah. I mean,
But yeah, I can see where those other diagnoses can definitely come in. But I'm not really seeing, I mean, I didn't hear anything regarding her hypervigilance or exaggerated startle response
right.
or anything like that.
Yeah,
Um, so I mean, I don't know, maybe I'm just, yeah, I'm not seeing any dissociation so much or
right.
depersonalization or derealization.
Yeah.
Yeah, she's very aware. Um,
Really
a
aware,
little
yes.
bit maybe to her detriment, honestly, because of what she's been through. But
Yeah.
yeah.
Right. Yeah. I mean, I'll be very honest. I'm glad we're collaborating on this because I would struggle to diagnose this by myself
Yes, yeah. She's
because she
definitely
meets so
complex.
many criteria.
Yes. Well, and then it's even like when I'm like reading through like the avoidance or efforts to avoid external reminders
Mhm.
that arouse distressing memories. I do feel like that is playing into her repetitive behaviors. And
Right.
so it's like, I don't know. I feel that way with most of the things that we're doing with the case studies. I'm always like, oh, it could be this or it could be that. And then
Yeah.
it's hard for me at this point to like sift them out. Like it's definitely this. I never feel fully confident in it yet.
Yeah, there's sometimes blurred lines and sometimes only seeing a person once too. I think
Mhm.
it's
Right. I
really
know.
hard
I
to
know.
tell. I think I don't know in the real world, maybe several it would take several sessions if you can, if you have that opportunity. But yeah,
Mm-hmm.
it's hard.
Mm-hmm.
At least some rule in, rule out diagnoses going on.
Yeah.
Yeah,
Mhm.
absolutely.
I think if I like had to choose one for like insurance purposes, like just to put one on there to stamp it and be like, okay, like we can build a session,
Yeah.
I would just put generalized anxiety disorder
Same.
Yeah.
or like adjustment disorder just for the time being until we could do like assessments or until we could do something else because I definitely don't want to stick her with um like a heavier diagnosis, like a more weighted one, if
Mm-hmm.
someone were to see this paperwork, right off the bat and then have to change it later for some reason.
Mm-hmm.
Um, but that's just like I don't know, that's just my thought process on it. Um, but I don't
Yeah.
know if it's just generalized anxiety disorder. I do think it's more than that.
Mm-hmm.
I do think for insurance purposes, I agree with you, Erin. I would probably be the most conservative route while still being able to get the insurance to cover for it. And then again, assess for other symptoms and uh, throughout the process, because we can always add diagnoses, but I mean, especially for a heavy hitting one, like let's say borderline personality disorder. Sorry, my cat's yelling in the background. Um, Once you have a personality disorder, that's just kind of stuck
Yeah, you can't
there.
walk it back.
Mm-hmm.
So yeah, I do appreciate the conservative approach as far as diagnosis.
Yeah, I agree.
Mm-hmm. And I do feel like generalized anxiety disorder does capture a lot of like it just is like a little, I don't know. It's late at night, so I'm doing that. I don't know what the word is, but it does feel like it captures a lot of the different pieces that she's struggling with. But I do think that like there are some more specific diagnoses that would pinpoint that a little bit more, but I do feel like it's a good starting point for her for sure.
So presenting problem would be extreme anxiety with the possible diagnoses. I mean, obviously she's got OCD, and then for insurance purposes, generalized anxiety disorder.
Hmm.
Are we in
It's
agreement on
good.
that?
Yeah.
Okay.
Yeah.
Um, so as far as treatment options, I do like the internal family systems as well as EMDR and maybe the ERP as well.
Mhm.
And the nice thing about uh, treatment is that we can combine
Mhm.
those. We can be very eclectic in our approach.
Mhm.
So maybe we start out with internal family systems and then gradually add the other two in.
Mhm.
Yeah.
Yeah.
Mhm. I
And
do.
that way,
I also like. I think that you had said, Erica, like the DBT stuff. Like I feel like that was one of the things that she had said was that she really wanted like tools to help her manage like daily life and distress. And so I feel like that could also be like a place to kind of weave in there to start with, like giving her some of those like
yeah.
actual tool. Yeah.
And it would also increase her awareness of her. I mean, well, she kept saying, well, it's not my mother's fault. It's not my mother's fault. But
Mhm.
it would increase her awareness as to with DBT, there can be a lot of, forgive my lack of vocabulary on this, but manipulative behaviors as
Mhm.
evidenced by the weaponized suicidal ideation.
Mhm.
And it's going to be a lot easier for Haley to make certain boundaries with her mother around that behavior
Mhm.
when with the increased psychoeducation.
Yeah. And ability
And
to like tolerate that distress too. I think that there's a big part of her that just keeps appeasing it because that feels comfortable and that's known. And
Mhm.
if she challenges it, that creates a level of distress that she's not ready for, so
Yeah. And
and it
in many
might
ways, she's very parentified, but in other ways, as she said, she's very immature that she won't cook for herself
yeah.
because of her anxiety. I apologize. I didn't mean to interrupt anybody.
No, it's okay. I think we just like keep talking at the same time, so it's fine. Don't worry about it. No, I also like DBT for this because of her anxiety. I think that in between sessions, it would give her something to do because DBT has a lot of homework,
Yeah.
like a lot of worksheets and stuff. So I think that that's something that could help. Not like I don't even know if distract is the right word to use here, but just kind of fill her time in between sessions of oh, like, did I say the right thing? Did I respond the right way? Did I answer the
Mhm.
question the right way, like in the last session? And maybe just like having those worksheets and the homework could help her as well.
Yeah.
It might
So yeah,
ground
I do
her.
like DBT for that. Yeah.
Yeah.
Mhm.
I think that that's a good point too. Just like another one of her identified goals was to build confidence. And so I think that the homework can be like a really good bridge for that. It's just like taking it into her own hands, like letting her feel a little bit empowered and like she's in control of this.
Mhm.
Yeah, I was gonna
And
say
if
it could be very grounding.
Mhm.
and it would
Yeah.
also increase maybe some social aspects because DBT is not just it's also a group
Hmm.
structure therapy as well.
A good point.
Mhm.
So then next
Okay.
steps.
Treatment. No, I'm just kidding.
Yeah, right. Do all the
Yeah,
things.
do it. Yeah. So I think you said you kind of both Nora and Erica came up with it together, but like not only having her individually, like I think regularly like once a week, but you mentioned the social aspect, Erica, of her being in like a perimenopausal group for women her age, and I think that that's a really great next step for her, for sure.
Hmm.
Yeah.
And I
Yeah.
think
So
like,
definitely
oh,
a
sorry.
support group. No, go ahead.
Yeah, I mean, I think it's like the individual treatment, maybe like the support group, and then also like Aaron, like kind of what you said, that I think that she's looking to explore different like exercise options for her too, as a way, like so even just like I don't know, isn't an option for you to join like the Y, whatever they have in the UK, or like can you go swimming or do some restorative yoga or just help her like that could almost be one of her homeworks too, is just to like try something different each week and report back on that.
Yeah.
What about coordination, like among her different providers too?
Hmm.
Find out who
Yeah,
she's been
definitely a
working with.
case manager would be helpful for her.
Yeah.
Yeah, that's a good point.
Medication, understand what she's taking, what she's on.
Hmm.
Hmm.
So yeah, I guess so. You case manager and then a psychiatrist.
Yep.
Hmm.
Yeah, like getting in touch with them or making sure she is
Definitely
in touch with them,
coordinating.
gets in touch
Hmm.
with them. Yeah. Okay.
And I mean, if nothing else, I mean, touching back on the perimenopause, menopausal thing, I mean, a lot of divorces happen about this age and stage in her life. And the case manager could also help with housing, finding a lawyer, that kind of thing, in the event that her marriage doesn't last through this stage.
Hmm.
Because with increased independence, I'm thinking there's going to definitely be some marital conflict more than there already is.
Hmm.
Okay. So barriers that could get in the way of collaborating. Just the case I think would definitely do well to keep everybody on the same page with periodic meetings, team meetings. They don't have to be super long for care coordination. I can see that in my experience, psychiatrists are terribly difficult to contact
Mhm.
Yes.
or terribly difficult to respond. So that could be a major issue as well. Just because, and it's not that they're intentionally doing it most of the time. A lot of it's just a lack of time in their schedule to uh, go through with it,
Right.
keep the meetings. Maybe a nurse practitioner would be a better option after the initial psychiatric visit.
And I think that that's a good point too, to kind of even think about other means of communication for collaboration versus like having a meeting. Like, I don't know, I feel like psychiatrists are all like they're billed for certain, and like so if it doesn't fit into the billable
Absolutely.
hours, then that's not going to fit into the schedule. So like even if it means that person has an administrative assistant and like can just, like give an update or just periodically
Mhm.
send some sort of information that's important to her treatment. But
So yeah, the team, obviously there would be Haley, the facilitator for her support group, um,
mhm.
case manager, the psychiatrist and or nurse practitioner. Um, and then depending on what, I'm not really sure about the including like a fitness coach or somebody like that until she decides hard and fast on a
Yeah.
preferred
Yeah,
exercise.
Yeah, I wouldn't
yeah.
want to pressure her with that either because maybe she'll want to try a couple of different things or,
Right.
you know, it could be as simple as walking every day, you
Mhm.
know?
Right. And I do want to have her have an amount of control and independence
Mhm.
so she can feel accountable for something.
Yeah.
Well, and I feel like what struck me with her too is just even how she started off saying like this is something that she's dealt with since she was like 4 or 5. Like it feels like it's so much part of her identity that
Right.
would also like just as a clinician that would also be a goal like to just start to like shift away from that there's other facets of her that aren't related to her mental health or her mental illnesses. Um that
And
like, I don't
DBT
know, if
is
she's
great about
engaging in some
addressing
fitness
that.
stuff, like I want her to just like be there without it being part of like a treatment
Hmm.
team, like
Yeah.
Um, I think that another barrier, this kind of goes along the same lines of poor communication between providers that can happen. But I think a lot of providers have different goals as well for their clients,
Mhm.
especially across like an MD, like a psychiatrist, and then like a case manager that might be like a social worker. Very different goals for the outcome of their client. Whereas I think, and even this is like, I don't even know, like I would have to ask, like, what's your goal for our
Mhm.
client? So I think establishing that in the beginning and making sure they're like we're all on the same page,
Yep.
so that it doesn't come up out of the blue, like one day that the psychiatrist is like, okay, I'm done, and everyone else is like, no, she has like months to go, and the
Mhm.
psychiatrist says,
Right.
I'm okay, she's stable, we're fine. So
Yeah.
just making sure we're all on the same page there, that could be a barrier for sure.
Yeah, that's a very good point. Yeah,
Mhm.
we definitely need to support each other's desired outcomes, provided that they're compatible and explore the barriers to why they're not compatible.
Mhm. Mhm.
Mhm.
I think something else as we talk about collaborators and everybody, all these different people that are there to help her. I mean, maybe you know, she's her own barrier in terms of her own belief that she's unworthy of help, which could cause disengagement. So you want to make sure that everybody has clear communication and they're setting boundaries and they're transparent about everybody's role so that she feels really supported instead of overwhelmed.
Mhm.
So everybody has to like
Excellent point, Caroline.
communicate really clearly and provide that transparency, I think,
Yeah.
because it can be a lot of cooks in the kitchen. So
Mhm.
Yeah, we don't want to oversalt the broth.
yeah, exactly.
Okay.
What else? I think that's
Yeah, I feel like that summed it
we
up,
did
right?
it.
Like that, we went through all five. Yeah.
Yeah.
I hope I work with you in the future. That was the easiest collaborative meeting I've had ever since I entered this field.
Right. If only they all went like that, right?
Right.
Mm-hmm.
What's the next step? So this video is what we will turn in then?
Mm-hmm.
Yes.
Yes. Yeah.
Okay.
So I'll upload it to, or you want me to send you guys the link too? Do we each have to, I don't know if we each have to
She
upload.
said we did each have to
Yeah.
submit. So
Okay.
yeah, if you could just send us the link. The only problem is I once tried to turn in a video and it didn't work for me on YouTube when I don't know. I hope, you know, if it's over 15 minutes, I hope that I can figure out how to turn this thing in.
I know. I had trouble with that. Yeah. The other day too, but I eventually did. I don't even really remember how I did it, but yeah, hopefully this works.
Yes, okay.
Let me know if
Right.
it
I'd
doesn't
like,
too, but yeah, and we'll figure that out.
my
Great.
computer froze up again. How are we going to share this?
So I'll send it in the email that we had. I'll attach
And
the
my
video
computer's
to it.
frozen again. I'm
Oh,
sorry.
That's
You're going to upload it where?
so I'm gonna send it in our email chain. I'll attach it through the email, and then if that doesn't work, let me know and I can figure out maybe a different way to
Okay.
send it too.
Thank you, Nora.
Thank you.
Yeah,
thank
absolutely.
you.
Thank you, ladies.
Thanks,
Have a good
guys.
night.
Great night.
Bye.
Bye.
Bye.